Hello, everyone, and welcome to What the Health. I am your host, Nikko Jones, along with my co-host, Justin Alden. Topic today is patient engagement. What is patient engagement? Exactly, what does that mean to you?
I think it means that you take an active role in your health. You monitor what you eat, you monitor your activities, you are up to date with your physicals and doctor's appointments.
I would even argue and say that things like social media and Facebook would actually be, a great resource and another factor that would indicate that you're actually being engaged in your health. Did you even know that almost like 72% of internet users looked online for their health info within the past year? And I bet you a vast majority of those people have social media and we're actually looking at social media as being one of those outlets.
Yeah, I read some random statistic that said there's like 4.7 billion Google searches every day, and 1 out of 20 of those is health related.
What are some other methods as to how patients can actually get some sort of like hard, concrete, discrete data?
For instance, today, Cyber Monday, I'm going to buy a Fitbit. That's how to be engaged.
You know what, Justin? That is a great idea because I, in fact, just bought one myself. In that Fitbit, for instance, I'm going to be using it to track my sleep.
Yeah, I agree. And tracking your diet is also like having a food journal is how to be engaged. Maybe checking your My Chart if you're an Epic. Just logging in, making sure that you are, like, let's say you have, getting a blood test and you want your A1C levels.
Absolutely.
So it's
Now, to kind of add on to that, exactly what would be some reasons as to why you would want to track that information?
It's all of our budgets are tight. So if I can lower my healthcare costs, by making sure that I don't get readmitted to the hospital or infected if I have surgery.
Absolutely.
Things like that where, because if I'm not healthy, then it's going to take a longer time for me to recover and I'll be out of work longer. I'll have to impose some sort of stress on my family because they'll probably have to take care of me. So it's, it's not just the cost of the hospital or the cost of more pills, which is certainly one thing that's explicit, but the implicit costs, I think, go unnoticed.
This next part of our podcast is brought to you by McDonald's. Where you can get a 64-ounce drink with extra large fries and a double Big Mac. So it's
okay, no shade to our sponsors, but what the hell? We're trying to get people. You know what? If that doesn't get you more engaged in health right now, the fact that a health podcast just told you about what you can get from McDonald's, I don't know what else will. But on that note, I want to introduce a couple of people to the podcast. Today we have Dr. Tara.
And also we've got a call in. Hello, Divika.
What's going on?
So a few years ago, I was diagnosed with type 2 diabetes, and since then, life hasn't been very easy. I think the doctor prescribed some metformin. I'm not sure what the pill is called. It's
Metformin?
white. I guess, yeah.
Yeah, okay.
Sounds so familiar, must be. But yeah, metformin, and I don't think the pill is helping me much.
Well, I don't see how it can help if you don't even know what the pill is called.
I feel like a lot of patients, since they're not engaged with their health, they'll just assume that a pill can solve all their problems.
I totally agree.
Yeah, so definitely like in our practice, we try to focus on patient-centered care where they're actually taking care of their own health, and it's not just us telling the patients what to do and like give them a pill and they don't even know what it is, but them actually taking charge of what medications they're taking and how often they should take it, and kind of them taking charge of their own health and not just us telling them what to do.
Right. I want to point out an interesting statistic that I saw earlier today, and it said that chronic diseases affect nearly 50% of adults and are obviously much more prevalent in our society than acute disorders and diseases. So with that being said, Devika, I'm interested to hear a little bit more about your situation. Talk to me about it.
How many pills are you on, for example?
I mean, initially I think I was on 2 pills a day, but then I guess my health didn't improve much, so I'm not sure what strength they changed it to, but he said something about extended release, so I'd be a little more comfortable with my medication, but it just sounded like jargon.
Do you understand why you're taking the medication for?
I mean, like diabetes, I don't go towards sugar. That's the thing that I was told, or that's the thing that I read online, and I try to stick to that. And like I try to get my test before I go to the doctor, but it's quite a hassle since it's like fasting sugar and the second type that I don't remember right now. It's kind of a drag for a busy schedule.
So I think, Nikko, this is a perfect example of somebody that's just not engaged with their health, and slowly their body is just shutting down.
What are some things that you would recommend as far as her being a little bit more engaged with her healthcare?
So diabetic patients have to control the nutrition, the weight management, the medications. It sounds like Devika has been, diagnosed with diabetes for a while now. If she had control of it before, she could have controlled it with just weight management and diet control. But because it's kind of gone on for too long, she needs to take that white pill that she doesn't even know that she's taking. But there's so many resources for her to get in touch with.
And is it, when the patients come in, have you seen it where patients that are engaged with their health, do you feel like they are, there's some continuity of care versus patients that kind of aren't really engaged or disengaged? They just, it's like one doctor visit at a time, and there's no real...
I mean, with diabetes, you can go into remission and have to take medication.
I mean, the costs are just crazy. I mean, I read a stat where I think in 2012, the total economic costs, roughly $245 billion in 2012, is spent on treating diabetes, and that jumped by almost 40% from 2007.
Wow.
So the trajectory is just not our friend.
Devika, I thank you so much for calling in today.
All right, so the next segment, we've got Amanda Blue from South Carolina.
So I'm currently 45 years old, and I was diagnosed with type 2 diabetes at the age of 40. The diagnosis wasn't really a shock because both of my parents have diabetes, and I was also living a very unhealthy lifestyle with frequent fast food eating, and I was also a smoker.
Oh.
It's actually very stationary. I had a desk job, and I didn't have a gym membership or anything. I was just constantly sitting. I'd seen the disease progression for my parents and like the different problems it caused for them. So it made me want to make changes to my lifestyle. And talking to my doctor, he suggested that I become more physically active and also change my diet. So those were the two things that I changed right off the bat.
Have you been able to control your diabetes better?
Before I made those changes to my diet and exercising, I was in the emergency room quite frequently for different things. But after that, I noticed that I was going a lot less. I didn't feel the need to I wasn't having random aches and pains and all the different things that was causing me to go to the emergency room.
Yeah, and that can get expensive too.
My medications have lessened since I've made the changes to my health. Before, I was on different medications, more than one, but since I've made the changes, I've been able to consolidate what I'm on.
So that's actually an interesting point. So with given the fact that she's been able to, stay on a good regimen, and she's being a lot more responsible in regards to what it is that she's taking, she's actually able to lessen the amount of medications that she's taking, and that in fact is obviously putting a couple more dollars in her pocket. So
and her employers too.
Right. So just by looking at that, we're able to see that there is a positive outcome by being more engaged in your health.
And Amanda, how many sick days did you take?
I was granted 2 weeks by my employer, and previously I was using close to all of my sick days, but currently, I've only used 2 in the past year.
That's great.
Great.
Yeah.
Well, Dr. Tara, listening to this patient, we clearly have a different scenario than we had in the previous caller. Yeah. What are some things you want to add to this?
This is our ideal patient. We want our patients to be this involved in their healthcare.
Amanda, are you engaged with your health through any sort of patient portal?
Yeah, I also I have a patient portal that is provided by my doctor's office, and I'm able to interact with my doctor through it. So anytime there's any smaller problem, instead of scheduling an entire visit, I can shoot my doctor an email. And
by her being able to access her patient portal, she's taking away that aspect of Dr. Google, right? How everybody likes to Google, their own problems and try to figure out things on their own. with her being able to message through a direct portal, she's getting direct access to her physician, someone who she knows and trusts, to give her the best possible answer. With her being more engaged through this patient portal, the doctor is able to see, okay, the more engaged my patients are, and the more they are, taking their health into account, the better off they're going to be. Clearly we see that she's decreasing her medication. She feels great. She's a lot better off than what she was when she was previously diagnosed.
Because you're more engaged with your health, you're seeing fewer sick days, lower healthcare costs, lower trips to the ER. Your physician is more productive. I think there's a connection there.
Yeah.
I don't want to go on a limb and say I think there's a connection.
If we get patients like her who come to our clinic, we're going to spend less time talking about, all this backstory that we probably have talked about many times before.
Yeah.
And we actually could focus on the future.
Gotcha.
Focusing on what's our goals now instead of trying to manage it over and over again.
So you're being more proactive as opposed to being reactive.
Yes, exactly. Yeah.
Great.
Well, excellent. Amanda, thank you for your call.
Okay.
Thank you.
Thank you.
Let's just summarize, a couple of things that we've talked about today. What are some things that you as a physician can do to engage your patient while they're in your care?
Like when you're engaged with a patient, that they're also more engaged with their health?
Oh yeah, definitely. I feel like when patients come and they ask questions and they know, why they're coming to us, then we're not going to waste time. I'm not going to waste time talking to them about their disease. They know what the disease is. We can focus on the important things now.
Yeah, kind of how to get better.
Definitely.
Which is important because, do you also use MyChart too when you talk to your patients?
Yeah. And privately message me about their problems, and I definitely encourage my patients.
And they can
to
get the results.
Yes, and they can get their lab results. They can get, I can tell them what they need to do not do. They know what medications they're taking through MyChart.
It's actually a portal that's used by several of the different hospital networks in our city, and I'm sure there's, it's widely used amongst the country by other places. But specifically, if I'm not mistaken, this is on the Epic system?
Yeah, so it's highly encouraged for anybody. MyChart is with Epic, but there's also many different patient portals that don't use Epic. They use the other eClinical Works or Allscripts, those kind of EMR systems. But everybody has their own patient portal.
Okay.
And it's very encouraged for physicians.
The reimbursements are...
Yeah, and that was going to be my next question. From what I understand, there is some sort of incentive for you as a physician to utilize the system and to actually have these kind of resources available within the system, like the patient portal and things like that.
Yeah, physicians have cost incentives to use these patient portals.
Well, I think that about wraps up our segment today on patient engagement. Do you have anything else you want to add, Justin?
Well,
you always do.
I know. I'm sorry. I just can't help but. What are some just 3 simple, whether it's technology or how can patients be more engaged or get more engaged with their health or with their physician?
So the first thing I recommend is patients knowing, what diseases they have and what they're at risk for, and knowing what medications they're on. Especially they need to know what kind of side effects to look for. The second thing is to find a support group. Find other people who have your disease so they can talk to them, and you can
have some accountability.
Yeah, definitely.
Yeah, I always find it a great, just bouncing ideas off of somebody else, and with the statistics we gave earlier, it does seem that there are, we have the numbers of people that are online. It's just being able to kind of steer them in that right direction and put them into those, sites and portals. So as a physician, just to kind of stress on that step, do you recommend any sites or any social groups that they can kind of?
You can go to the American Heart Association if they and find patients with some diseases, or the American Diabetes Association, American Cancer Association, those big groups, or even Facebook, Twitter. They all have support groups that patients can join. Definitely.
Great.
And then I think the third thing that the patients should kind of, so they can engage themselves in their health, is to, when they go to their physician, have questions.
Great. Well, thank you for joining us.
Thank you. I'm glad
Appreciate
to be
it.
And I thank you guys for watching our 1000th episode of What the Health. Thank you so much, Dr. Tara, for being here, and thank you, Justin, and we'll see you next week. Thanks.